Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today, I am speaking with somebody who I have admired for a very long time. So I'm honored that Dr. Yona Lunsky is here with us today. Dr. Lunsky is she's an extraordinary woman as far as I'm concerned. And I know a lot of people feel the same way. She's focused her research on the mental health needs of people with intellectual and developmental disabilities. She's the director of the Azrieli Adult Neurodevelopmental Center and a professor in the Department of Psychiatry at the University of Toronto. Dr. Lunsky, can I call you Yona?
Please do, Tamara. And thank you for all those really nice things.
I'm so happy to have you here. You know, before I get you to explain maybe some of the work you do, I want to start really basic here. What is an intellectual disability and what is a developmental disability?
Right. So I think in every country, and even in Canada and different provinces, we use different words to talk about some of the same things. So when I think about an intellectual disability, that is something that we might find in the DSM, which is sort of our diagnostic manual that has lots of names of different diagnoses and what they mean. And it usually suggests that the person has a cognitive ability that is below sort of what's typical or more average, as well as day-to-day difficulties, what we sometimes call adaptive behavior deficits. So problems sort of managing their day-to-day, and that these difficulties start when they're children or when they're babies even, so in the developmental period. So that's an intellectual disability, but I sometimes talk about developmental disabilities because some people like that term better. So someone who is autistic or someone who has Fragile X syndrome or even Down syndrome, or fetal alcohol spectrum disorder. These are all names we give to certain types of disabilities where there's often sort of cognitive issues as well as day-to-day adaptive behavior issues, and they all happen in the developmental period. But the person's actual sort of level of intellect, say from a psychological assessment, might be a little higher than 70, or it might be 80, or it might be 90, but it doesn't mean they don't have difficulties managing day-to-day, right? So developmental disabilities is a little bit of a broader term, I guess, than what we might say is an intellectual disability.
I know that you know this. My son is 13. He has Down syndrome. So I just say he has Down syndrome. I don't say he has an intellectual disability or a cognitive disability or a developmental disability. I just say he's Beckett and he has Down syndrome. And I know that we kind of like to put labels on things in this country. But your work is really focused right now on the mental health of people with developmental disabilities, their families. Is that right? Can you maybe explain a little bit of the work that you're doing right now, or your main focus right now?
I used to think actually that these disabilities were mental health problems, right? We kind of now appreciate, no, they're really not at all. But I think if you're trying to navigate a world that's not really well adapted to support you, then that's going to be hard. And like everyone else, you're going to need mental health supports. But in fact, this group, I think, has more difficulties navigating their day-to-day. And so, as well as maybe some sort of things in their almost biologies or their brains that might sort of predispose or kind of put them at risk for having more mental health issues. But yet our mental health system wasn't designed for them, right? So if somebody's struggling, I mean, think about right now during COVID, if somebody is having a really hard time managing their anxiety or feeling just really unhappy with their, gaps in terms of being able to do the things they enjoy, see the people that they love, and these little feelings of sadness or anxiety don't go away and they become quite serious, where are they going to go to get their help? So I think that our mental health care providers in Canada are not trained to figure out how to adapt their approach to support people with developmental disabilities and their families. So it really puts them at a disadvantage. So we need to speak loud about what their issues are and think about ways to help everyone be a little more accommodating to make sure that their mental health needs are met.
I think that, I found that typical people, if you will, are struggling with their mental health right now during this pandemic. And a lot of people I know in the Down syndrome community, all their services have been taken away. So whether that be, their speech therapy or a day program they go to, or maybe they're not going to school because there's too great a risk of getting sick. And so now they're home. And it's hard for me to comprehend. I know it's very difficult for my son. He doesn't understand what a pandemic is. He doesn't understand why he can't see his grandma. There's so many things he doesn't understand. So it would be hard, I think, to know like what is just sadness with him and what is anxiety, or what is like how it comes out. Is that part of the challenge for families too? Is kind of knowing when it's crossed the line?
Yeah, it's an interesting way to put it, right? That we're all in a continuum. I think we all have good days and bad days. And, it's perfectly normal to be abnormal right now to some extent, right? We're all kind of worried. We're all down. It kind of sucks what's going on. But when is it the point where we need to really be worried and we need more help, right? And I think that the way we might describe a problem like, clinical depression or serious anxiety is based on how we would usually see it in people who don't have developmental disabilities, right? So I think figuring out, is this a problem I need to be concerned about? It's kind of like detective work we need to do, where we say, well, what, for your son, like, what is he at his best? How is he usually, and how is what he's doing different right now? How long has that been going on? How different is it? And why should we be concerned? So I think really understanding what people are like, we call that sometimes their baseline, or sort of just what's typical for them, but it's very unique to that person. So understanding how it's different, and what's sort of a concerning different as opposed to, well, it's just an off day, can be tricky to figure out, but it's really important.
It seems like there is an enormous amount of discrimination towards people with intellectual and developmental disabilities. And I didn't think that before, because I think I was in the bubble of my little boy, and now that he has entered high school, and it's a very different world. And I think that this pandemic has really hit it home for a lot of people.
As a healthcare provider, I know we don't have enough healthcare services for this group. There's no doubt. We have huge wait lists. We have people in crisis. We have all kinds of issues. I think this group is frequently forgotten and overlooked. So how can that not be discriminatory? It could just be like naive, or we didn't realize, or we didn't notice, but we've made it clear, like the facts are there. So I think if we're choosing not to address them, there probably is some, whether we call it discrimination or ableism or something, there's some things that we value more than others. And this is a group of people who are at the back of the line, right?
Mm. Yes. And I think that, even when I watched the documentary Crip Camp, and it was mentioned in that documentary about how there is a hierarchy of disability. And I had to actually pause the movie, and like it hit me hard, and it's so true, and I never really considered that before. I have yet to hear anybody in our PHO say the word disabled or talk about the group of disabled people in this province, or the disabled people in Canada.
Yeah, no, absolutely. It's a huge number of people, but for some reason, I think we talk about a lot of isms in our country, but we don't talk about ableism, right? We don't talk about people with disabilities. We don't see disability, right? We see you as equal. We don't need to see your disability. Well, if you're going to accommodate me, you're going to have to see my disability, right? And if you want to understand what I need, you have to look at me. And actually, there are some things that are different about me than you, and there's some unique needs that I have that you don't have.
Yona, when we look at this, we know that it wasn't that long ago that when somebody was born with Down syndrome, or if somebody, was born with a disability, the parents were usually talked into putting their child in an institution. It wasn't that long ago. So
Sure.
our history is to, shut people away, really.
I mean, I think our history, and maybe there's probably lots of contributors to this, but I think that, certainly from the healthcare side of things, we didn't do a great job. We kind of medicalized disability. We told families, and we told my family, right? We told families, this was not that long ago, as you say, right? That the best thing we can do for your loved one, is for them to go over here, right? So, how trusted is health and healthcare if that's the best thing we think we can do for people, right? So how do we kind of reconcile that and come together and say, no, you can trust us. We really want to do good research and we really want to help you because we have your best interests in mind. What does it take for us to kind of rebuild and create systems where we do the right kind of work with people instead of discarding them? So maybe we don't look because we're trying to show that we're not being discriminatory. But there's like a way you look, I think, to maybe be less discriminatory, if that makes sense. But we have a lot of baggage and a lot of stuff we have to unpack, and a lot of trauma we have to recognize, I think, to move forward.
100%. Before we talk about vaccines, at TELUS, we really like to find ways to give back to the community, especially during this pandemic. And one of the ways is we ask our guests on this podcast to, to give us the name of a charity that they that means something to them. We're going to give $500 to People First Canada on your behalf. I know all about People First Canada. I think they're pretty amazing, but maybe you could tell us why you chose them.
Sure. I think I actually first learned about People First Canada when I was a kid, in terms of the amazing work they were trying to do as self-advocates, finding their own voice, and at that time really trying to push for the closures of institutions and advocating for their rights. I think it was my mom who was probably first exposed to them, right? It's a really important international self-advocacy movement, but there's really tremendous leadership, I think, here in Canada. And I thought of that organization because when the pandemic hit, we were trying to figure out what the heck are we supposed to be doing and how can we support people. And our center started to do some work with People First to think about how do we just try to answer people's questions and talk about what's going on. And we've been in a project with them since the fall where we actually have been doing a course together with them virtually, just like this, right? But imagine, 20 people from around the country who are all leaders in their own provinces or regions from People First, talking about sort of the mental health impacts of COVID and what kinds of resources and supports and things we can put in place for them and that they can share with other people who they, work with through their organization, through their local organizations to help build up everybody's mental health at this time. And also for us to learn, I think, which was really important, what the issues were that were most important to them. So I might have my own ideas about what I think is most important for them to know, but in doing these groups with them, I think we really learned from hearing from them, like what matters and, how to explain things and what is still not being addressed and what is most helpful for them from them. So I thought, anything that can help support the work that they're doing to try to support each other better and advocate for their needs is really, really important.
Well, we are happy to give them $500 on your behalf. So I'm really happy you chose them. That's amazing. So when it comes to people with disabilities and COVID and the vaccine, and we're talking all about this, and we're hearing about vulnerable people, and we need to vaccinate vulnerable people fast. And vulnerable has become an interesting word, right? Because I think it means something different to a lot of people. But when it comes to people with disabilities and the vaccine, it doesn't seem that they're vulnerable enough to make it to phase 1, to make it a priority.
Yeah, first of all, there's disability generally and sort of where it falls in terms of mention. And then there's specific types of disabilities. And I know the most and I understand the most in terms of what the research tells us about people who have intellectual or developmental disabilities. It's kind of the topic we're all looking at right now, right? And I think, first of all, your question about vulnerability, what is it about the person, like in terms of how their body works, in terms of how their immune function works, that makes them vulnerable? What is it about the situations they're exposed to that make them vulnerable? So vulnerable, for example, to being exposed to getting COVID because they can't keep people who are coming from outside of their own home from touching them because they need someone to give them personal care, right? And then what makes them vulnerable if they have COVID to the kind of care they're going to get and how they're going to manage with that COVID, right? So it's not just about things within them that make them vulnerable. I think we have to appreciate that vulnerability is also about how they navigate the system, both putting them at risk for getting COVID and then also dealing with or addressing COVID. So there is evidence from other countries showing that people with intellectual and developmental disabilities are more vulnerable to being infected, or they were more vulnerable in the early part of the pandemic to be infected with COVID, and that also their outcomes are worse. And this shouldn't surprise us in that, we use a term, and I've done some research on this, so we talk about premature mortality. So if there's like a perfect age everybody's supposed to die, it's 75 and onward. That's sort of the time when people should die. Well, people with developmental disabilities are almost 4 times as likely to die prematurely, and that's before COVID. And again, that's because of the vulnerabilities inside their bodies, right? As well as I think their vulnerabilities in the system. So that stuff existed before COVID, and then COVID hits, and it's hard to make sure you don't get COVID necessarily. It's hard to report on your symptoms when you first start to have them. The kinds of treatments you're going to get may be the same as everyone else, but they may not. And it might be harder for your body to fight the infection. So we know from other countries that people with intellectual and developmental disabilities are also more likely to die if they have COVID than other people. As recently as last week, more research came out from the UK saying that even if we adjust or control for where people live, if they're living in a group setting or living, more independently or with family, if we adjust for sort of how wealthy they are in terms of whether they live in a wealthy neighborhood, what their sort of family income might be, if we adjust for the different types of health conditions and things that are going on, their sex, their age, all those kinds of things, we still see they're more likely to die than other people, right? So there's something going on we can't ignore if we look at our numbers from other places. And certainly, I think as a mom of someone with Down syndrome, you would feel very worried about this because there's specific research that's come out showing that, one group of people who does have difficulty fighting infections and do have certain kinds of respiratory vulnerabilities and other healthcare issues, especially once they hit adulthood, there's real fears around what's happening for people with Down syndrome if they get COVID. And, there was one large study that was done that showed that those individuals relative to other individuals, again in the UK during the first wave, were 10 times as likely to die if they had COVID, even when they adjusted for a lot of these other kinds of things I was mentioning. So those are really frightening numbers. It doesn't mean that everybody with a developmental disability is going to die if they get COVID. That's still not the case. But there's clearly evidence that suggests they're more vulnerable than other people. And the other thing that's important in the evidence has to do with the age at which people are vulnerable. So we're taking a very sort of general approach saying most people who die from COVID are older. So let's really invest heavily in our oldest people, right? So we're going to start with vaccinating our 80-year-olds, and then we'll go to our 70-year-olds and our 60-year-olds. And that makes perfect sense, assuming we all have the same lifespan. But for some people with developmental disabilities, they don't live as long. And so some of the difficulties they have are going to show up at a younger age than 80. In fact, most people aren't 80 with developmental disabilities. So we've got some pretty vulnerable people, for all the reasons we talked about why people are vulnerable, that might be vulnerable at 50, right? Or at 40. And so do they need to wait for when we vaccinate all of our 40 and 50-year-olds? Or do we need to think about some people who have heightened risks, getting that vaccine earlier?
I mean, and yes, everything you're saying. And I guess the mystery is, I know all of this research because I've read it. Obviously, because it is very meaningful to me and my family. So it's important that we know what's happening worldwide when it comes to people with Down syndrome or intellectual and developmental disabilities. What do we do in this country, or what can we do to create some change?
I think if we're left to do all the advocating ourselves, so if people with disabilities, if my sister, if your son, if it's all on them, they need families. And as families, we need allies beyond just families, right? So it's got to be a bigger community of people stepping up and saying, we value this group of people, right? So what makes people step up and say, this is important? I think one thing that makes people step up is having a personal experience with someone, right? So you're going to use your podium, with the work that you do, because this is really important to you and your family. I'm going to, as a researcher and a family member, I'm going to speak up as well. But we need other people to speak up who aren't just family members. So how do you get those experiences? You get to know people who live in your neighborhood, in your community, in your school, right? In your church, in your dance class. So I think the more inclusion that we're doing and the more positive experiences people are having, the more this becomes our problem and not their problem, right? Because it's our whole community who's involved in this. And why wouldn't we be thinking about that person? We take care of each other here. This is what we value. So one piece, I think, is making sure that everyone is out there, welcome in the community and having some good experiences. Sometimes I say we need to combine, because that makes people speak up, I think. I think we also need sometimes different types of evidence to make things move forward. So I said sometimes we need stories, because it's the stories we relate to. It's the people we know and we connect to. And then we need to put that together with the numbers, right? So in talking about vaccines, if that's the thing we're focusing on, we're talking about mortality. One of the studies that came out last week said that 6 of 10 people in the UK above 30 who died with COVID had a disability or were disabled. Well, that number tells us something, not just the sort of this times is likely, that times is likely, but the actual number of people we're talking about in our community. We're talking about 1,000 people who live here, with us, and everyone in their families that are impacted by this. So I think numbers together with stories is important. And I think sometimes the numbers almost do a disservice to us, right? Because we just present this problem and it's so big and everyone's like, oh my God, I don't know how to deal with that, right? That's just a huge problem, right? So we have to show people there's a solution. It's actually not that hard. These are some things we could do and it actually works. I think we need to celebrate every time, whether it's something that happens in the classroom or in the hospital, or in the community center, something that works well, and looking at the people that help make that work well and recognizing and celebrating them and taking it apart. What were the ingredients here that made it work? What did everyone do? How can we do more of that? It's important for us to learn from those things, but it also gives us a sense of pride, right? Of something that we did. It gives us something to celebrate and it's something to work with. So I think noticing, like really calling out things that are bad, yes, we need to do that. But noticing these things that are working and that are good, I think can help fuel more positive energy toward making changes. So people don't just say, well, that's a really big problem, I don't know how to deal with it. To saying, oh, I see we could do this. That makes a difference. And then more people get excited about it.
We do have, March 21st coming up. It's World Down Syndrome Day. At the very beginning, I didn't really partake in it, but now I didn't. And now I just I see the value in a day like that, because I can explain why it's on March 21st. It's, the third month, it's the 21st day, and people with Down syndrome have an extra copy. They have 3 copies of the 21st chromosome. And whenever I tell somebody that, they're like, oh, I had no idea. And it's just, you're right, that little story, right? That little tidbit. And then people don't forget that. So you're totally right. I think that, when we find those nuggets of positivity and those stories, to share them because they are so meaningful.
I think even with the pandemic, there's so many amazing little local stories of things that people have been doing that can be noticed and celebrated. I remember one of my kids, presenting in their science class on, the 21st of March, explaining what Down syndrome was. And that I was so proud of that, right? Like that he wanted to learn about it and share it. When there's one kid in the class who has a sibling with Down syndrome. And what does it mean to hear that story, right? Or what does it mean if you have Down syndrome and you're in that classroom and somebody else is going to talk about it because it's important?
Yeah.
right? Like we don't know what's going on in anybody's family. So every time I think we tell a story or we say something is important, somebody's going to hear it who hadn't heard that someone thought that was important before, you know?
Yeah. I can't thank you enough for taking the time to speak with us. Really, there's so much to learn from you. And I read everything that you tweet out, you publish. I'm a big fan, Yona. I'm a huge fan. So thank you so much for being here. I really, really appreciate it.
Well, thank you so much for putting this on the agenda and for including me. I really think that it's about us all just having conversations and working together, right? Like, I think you have a wisdom that only you have because of your experience. And my work is only going to be enhanced if I actually learn from you. And I think that's how we have to approach everything, you know? Mm-hmm. So, yeah.
Yeah. Okay. Well, listen, you can follow Dr. Lunsky on Twitter at Yona Lunsky and find out more about her work at the Azrieli Adult Neurodevelopmental Center by going to camh.ca. Thank you so much, Yona.
Thank you so much, Tamara.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.